Welcome back. For infectious disease experts around the world, the first hint of COVID came almost exactly 2 years ago. An email sent out late on December 30th, 2019. That email landing in inboxes about a pneumonia of unknown cause, the first case linked to Wuhan's South China seafood market.
It's really too early to be confident about what the disease looks like.
There is evidence of human-to-human transmission.
Wuhan quickly became the world's first COVID hotspot. To keep up with the sick, we saw Wuhan hospitals built within days, the city sealed off.
The biggest concern is here in China itself.
But the virus was already global. Within 3 months, it was killing at least 7,000 people worldwide every day. But then another December milestone, this one a year ago. The first vaccines arriving in Canada, along with hope.
Today, really, we turn the corner.
But variants of concern also arrived in Canada, and this December we're contending with Omicron and still waiting for COVID-19 to go from pandemic to endemic and hopefully less dangerous. And Dr. Zain Chagla joins us, an infectious disease specialist at St. Joseph's Healthcare in Hamilton. First of all, Happy New Year.
Happy New Year.
Now, as we see Omicron's cases surge in many parts of the country, I'm curious about what you're seeing at your hospital.
Yeah, it's a little bit different than anything we've seen before. We have the biggest stress really being our healthcare workers going out with Omicron. They're not sick, but they can't come back to work for the isolation period, meaning staffing is getting tighter. We're seeing patients coming in with Omicron, not a ton, but they're definitely coming in. They're not as sick as prior waves. They don't necessarily need the ventilators, but they do need medical care. And then we're seeing the burdens from patients that test positive for Omicron, but are here for other reasons, like giving birth or needing an appendectomy or that type of thing. And, again, that's normal pressure, but it still adds another burden for all of us. We have to isolate those patients. They have to be in private rooms. We have to use PPE. And so, there's a lot of this going on. There's the staff positivity, there's the contact tracing, and again, the need for these healthcare beds for patients who may not be that sick, but are putting pressure on the system.
Different provinces are obviously treating this wave differently when it comes to things like testing or curfews or boosters. And from your perspective, is there any province that stands out to you as getting the response right?
This one is tough, right? And you look back to South Africa and what happened, there was this explosive wave that was, hard to contain. By the time people realized it was, time to get things under control, things came under control because so many people got infected at once. And we're seeing this around the world. And so, I think different provinces are adapting different strategies. The end result is Omicron is going to keep finding people, whether or not, you lock down, wait 2 weeks, it's going to continue to find people after that. And so, strategies that look at the healthcare system as a whole, look at preservation of the healthcare system as a whole, and react to that, I think are probably the most reasonable.
Yeah, so there seems to be this inevitability that most of us are going to get exposed to it, so trying to spread out, those cases over a longer period of time, I guess. But for people who are watching who are particularly vulnerable to getting very sick, so let's say immunocompromised people, elderly people, how do we deal with those people given how widespread Omicron is?
Yeah, those are individuals that need to be careful. They need to wear the best quality mask they can find. They, need to get their third doses of vaccine if they haven't. And, if they do develop symptoms, they need to be prioritized for testing. We have monoclonal antibodies. We've administered them to immunocompromised individuals with amazing results. We'll have treatments coming down the pipeline. And so, those people need to be really escalated for testing and escalated for treatment aggressively when the time comes.
We have just 20 seconds left, but do you see that light at the end of the tunnel?
Yeah, absolutely. Look, immunity is coming. The people that are going to get Omicron are going to develop really robust immunity for the future. And hopefully that's it. That takes us through this being an endemic disease and not leading to the healthcare strain that we've seen for so many years.
Dr. Chagla, thanks for speaking with us.
No problem. All the best.